Hello and welcome to this edition of EC3 HOSA Medical Moments. We've been bringing these programs to you regularly since COVID-19 has really taken over the country. And we've had individuals with our Lincoln Trail District Health Department come in and talk about the role of that department in this pandemic and also what we need to do. So joining us again today is Terry Bergen, and she is one of the information officers with the Lincoln Trail District Health Department. Terry, talk about your all's role right now.
Well, I mean, our role really hasn't changed. We are continuing to do what we've done all along in the COVID pandemic and before COVID. So one of the things that we do primarily during this pandemic is the disease investigation and the contact tracing. So we receive those reports, we contact those individuals who have tested positive for COVID-19, and then we also contact their close contacts to make sure that we advise them to self-quarantine, to stay home, and therefore reduce the spread of COVID-19. Now, while that is going on, we still are offering some services at Lincoln Trail District Health Department. So we still provide WIC. We are still, we just recently opened up immunizations to start providing those June 1st. Those are the only in-person services that we provide right now. Everything else is still primarily over the phone. So we're kind of mimicking what the governor is doing with a slow reopening of the Lincoln Trail District Health Department services.
Do you know when that will be in terms of other services being available there? I know there's testing and other, I guess, not physicals, but there's other opportunities for healthcare at that facility, correct?
Yes, but there are some things that we are evaluating. COVID-19 has done a really good job at identifying things that we can do well. Like, for example, our WIC numbers increased, and that may have something to do with the fact that a lot of people are unemployed right now and are seeking those types of services. But we love that our the WIC services were made telephonic, so it was easier. People could access it better. And so because of that, we think that also played a part in increasing our numbers. So we're looking at maybe to see if we can keep that. But we have to keep in mind, too, that some of the state requirements may not allow us to do that, but we're going to try to do that. So, yes, we are looking at the situation daily to determine when we will bring those other services back on board. So as of right now, it's just that one little in-person piece that we're doing.
Okay, awesome. Tell us where the district stands in regards to numbers.
Well, as of our press release time, 4 o'clock yesterday afternoon, we were at a total of 220 cases in the Lincoln Trail District. Hardin County is up to 108. LaRue is 12, Marion is 27, Meade 23, Nelson 44, and Washington stays at 6, has maintained at 6.
Now, does that also include numbers from Fort Knox?
Yes, they do include. If we have any cases from Fort Knox, they let us know and we report it as a Hardin County case.
So let's talk about the hospital numbers. You mentioned how many had gotten well and how many are self-isolating, but how many are currently in the hospital?
There are currently 9 that's in the hospital. So not that many. I mean, Gina, we've done really well. This area has done really well with low case counts, and again, I have to give the credit to all of the general public because they do the right thing with the physical distancing and wearing the cloth mask when they're out. It is making and has made a difference.
Right. So many people say, well, it's not as bad as it was. Everybody's, they're on one side or the other, but without what we did.
Right.
It definitely would have been worse.
Yes, I do believe so.
And I don't know if there is any way to show that to individuals, but a lot of times, you know, they are on one path and they're not going to stray from that path. But I think that without doing what we did as a state, it definitely would have been.
It made a huge difference.
A huge difference. And I know that when we first started taping these shows, you know, we expected larger numbers.
Oh, yes.
Especially with our population with diabetes and high blood pressure and things such as that. So we have really lucked out.
Done a really good job, yeah.
I don't believe there's been any new deaths reported since our last time. Currently, where do those numbers stand?
Well, as far as our district is concerned, we have 5 total deaths. Okay, so 2 in Hardin, 2 in Meade, and 1 in Nelson.
Right, and a death is not a good thing no matter what. I'm not saying that.
That's exactly right.
But and those individuals had loving families, and it's just it has been heartwarming when we see those articles about those persons that it makes you feel it was a loss to the community and things. Go over the guidelines again. Now that we're in this opening phase, like every week something new is able to open, what are those guidelines again that individuals should do?
Well, you know, nothing has really changed. It really hasn't. It feels like it has because things are reopening, but we are still encouraging folks to do the physical distancing. Now, you know, you don't have to do that with your own family. If you're living in a household with people, you guys are close anyway. But we want the public to continue to do the physical distancing, to wash their hands for 20 seconds, to use that hand sanitizer when the warm water and the soap is not available, to wear their cloth face mask when they're out in public. All of those things need to continue in order for us to ensure that we don't get a second spike and to help reduce the spread of COVID-19.
I know that when I've been in local businesses and doing some shopping and such as that, I have my mask on.
Yes.
So when I see others that don't have their mask on, I tend to try to avoid that area at that time. Of course, there's not much we can do with individuals. We can't be the personal responsibility police. Right. But I do think that our businesses have really stepped up above and beyond.
You know, and I think maybe the face mask does the cloth face mask, even the cloth ones, they do a really good job at helping to protect what you have, spreading that to other if you have anything to spray it. And I know that sounds bad, but you understand what I'm trying to say here.
Right.
There was a study that was completed by the New England Journal of Medicine. And so they actually looked at a gentleman and they put it up, it's kind of like a light screen, so that you could see him talking with the mask on and without a mask. With the mask on, the screen hardly lit up green at all. What they were looking at was the respiratory droplets that came when he spoke, when he got louder and started yelling, and the difference was incredible. With the mask, hardly any respiratory droplets were seen. Without the mask, even just normal talking, you could see just so many numerous respiratory droplets on that screen. So that mask makes a huge difference. When you couple that with physical distancing, it just ups the ante and protects people even more.
Now, what about the surface and, you know, keeping the surface areas and things? I know there's been mixed research coming out about that as well. So, but it's still good practice, wouldn't you say?
You are exactly right, Gina. It is excellent practice. Now, recent guidance by the Centers for Disease Control just said that the possibility that the virus is spread via surfaces is minimal. But keep in mind, if a surface does have the virus on it, and you touch that surface and touch your mouth and touch your eyes and your nose, you can still get it. But they are saying you are more likely to have COVID transmitted through the coughing, speaking, singing type actions more so than it being on a surface. The likelihood of being transmitted that way is very low. However, we ask people to continue to clean and disinfect those frequently touched surfaces. Still good practice, as you mentioned.
Well, and I think that's where individuals may not understand those surfaces when you are dealing with places such as the zoo,
Yes.
or amusement parks,
Yes.
or at community fairs and festivals.
Uh-huh.
You don't know how those surfaces are being sanitized.
That is exactly right. And so it's very important that you're cognizant, that you're aware of what you're touching and when you touch your face. And it's so hard to do because I don't think we realize how often our hands go to our face. For me, it's like my glasses drop a little bit and I'm constantly pushing them up. And I have to be really aware not to do that. Unless I'm around some hand sanitizer.
Well, I know that I was hearing discussion about Kentucky Kingdom not too long ago, and they said, and I was like, so does that mean they have to do hand sanitizers at the beginning and the end of every ride? That's a huge expense.
Well, it is. But now, if you look at the Healthy at Work site and the minimum requirements for businesses to reopen, one of the things that they must do is to ensure proper sanitation and provide adequate hand sanitizer and encourage hand washing. So, yes, the beginning, the end, anywhere that these hand sanitizer stations and hand washing stations can be strategically placed to reduce the spread is good practice.
Before we started, during this time, we've been seeing many nights of protest or days of protest in regards to some sad situations that have been occurring. How do you think that will affect the numbers that are COVID-19 positive cases? For one, we don't know if those individuals will be tested.
Yeah, that's right. You're exactly right. Anytime you are it could potentially increase our numbers if they are not doing those preventive measures that I talked about earlier. I can understand families walking together, right? That makes sense to me. But if you do not know the person, the protester that is next to you, you need to be at least 6 feet or more from that person, have on that cloth face mask, and hopefully have some hand sanitizer either in your pocket or in your purse that you can use to cleanse, get the germs off of those hands. We've seen in some places that has not been the case, that there are people grouped together. Elizabethtown did a great job. They've done a great job. What we've seen at keeping their distancing and wearing those masks. So kudos.
I was going to say, that's definitely a good thing. With summer and the reopens, what about, I've heard different things in regards to swimming facilities, and what should people do in regards to those water parks and those swim facilities, aquatic centers?
Well, they really should not be sharing any type of supplies. They should have their own towels. If they have the goggles should be theirs, no one else's. Even little snorkeling things, it should be theirs and theirs alone. There should not be any sharing among families. Family within a family is fine, but among families, different families, that is not recommended. It's hard to practice physical distancing in a pool. It really is. You have people going by and the deep breathing. I don't know about you, but it takes a lot of breath to swim. And there's no way you can swim with a mask on. So you just need to be aware of how you can implement what we've been saying all along at that site in order to keep your family safe.
Everybody was hoping that the summertime would kindly ease the numbers of COVID-19. Has the health department received any information to support that idea?
Well, we are seeing the numbers come in every day, as you notice. And if you look on our website, you've seen a slight increase in our day-to-day numbers. So that may indicate, though, that we are just testing more. And so, as you know, Kroger has been here twice. I think they're over at John Hardin right now, 2nd through the 4th of June. It's just going to increase our numbers. And then we have additional testing sites. Hard Memorial continues to test. And there are additional testing sites within all of our counties. So It's just something that we expect to see with the increased testing.
Now, with those tests, do you still need to have some type of symptoms to get those?
I am so glad you mentioned that, because it reminded me to kind of say that for those individuals that seek testing, whether they are having obvious symptoms or not, they really should stay at home until they get their test results. They should quarantine from other people. We know that the majority of people with COVID-19 have no symptoms at all. It's just good practice, if you're going to seek a test, to stay home, separate from others, until you get those test results back. And from what I understand, I'm not for sure about this, but it can take, depending on the labs, anywhere from 2 days to 10 days, 2 to 10 to 14 days, just depending on which lab is used. So labs have gotten a lot better, a quicker turnaround with those results. But most of the drive-through testing labs are a lot quicker. So if you could stay home until you get your test results back, you'll be protecting a lot of people.
And there's no cost for those currently, correct?
That is correct. No cost to go through the drive-through testing. Mm-hmm.
Right, and I know that a number of individuals have stepped up to make sure that that happens. Mm-hmm. Has the Health Department been involved with the re-establishing of sporting events? I'm not sure. I know that the Kentucky High School Athletic Association came out with extensive guidelines and even have labeled it as low touch, mid touch, high touch type of sporting activities. Has your all's department been involved in that in any way, or assist in that in any way?
Well, when it comes to the schools, our environmental director is working and helping to review those plans to make sure they are as safe, that there's a lot of good safety practice there to help reduce and prevent the spread of COVID-19. So that's how we're involved. The schools submit their plans, or they ask for our director to look at those plans, and then he provides input and guidance and advice. And so that's our role at this time.
Because we do know that with those high-touch sports, such as indoor, it had to be wrestling and basketball and volleyball, and outdoors, of course, would be soccer and football.
Yeah.
And lacrosse.
Yes.
I mean, a lot of contact, physical contact there. So with the environmental person on your staff, he's wearing a few more hats this time.
His role has increased so much since COVID-19. I mean, because we went from, because we were doing inspections at the restaurants, all that stuff that we were doing before kind of slowed down a little bit, in the sense that we didn't have to inspect the tattoo parlors because they were closed, that type of stuff, but it increased in other areas. That whole department became an enforcement department. So for those businesses that were not following the governor's guidance, if someone called in complaint, he had to check on that. And then the plans related to reopenings, a lot of people are seeking his advice on that. We get calls all the time about that type of information. Of course, he was handling everything on that complaint line. Every call that came in, they had to handle that information as well. So we have been enforcers, we have been educators, guiders, advisors, all of those roles, not just with the environmental department, but all of that is kind of what we've been doing through COVID-19, ramped up a little bit specifically for that.
Do you think that mid-July, August, that we will see numbers decrease?
I can't say.
I know, I was going to say, we don't have a magic ball, do we?
We do not.
And so it's hard. Do you all look at, of course, you all have to almost be forecasters.
Yes.
Because you have to prepare. So what are the look-fors when the summer happens and when more and more things get open?
Well, let me say this. We do look at data. That drives every decision that we make. And so we have a community epidemiologist that has plugged this into a software database. So we have a really beautiful epidemic curve, and it kind of looks at the number of cases that we've gotten by week and months, and it lets us know if we're in a plateau, if we're increasing, or if we're stabilizing. So that will help drive our decision to stand down a lot of things and reopen a lot of things. So that's what we're looking at. We're looking at the data. Mm-hmm.
And one of the things that I've heard too is that that you may be asymptomatic.
Yes.
But therefore have it.
Yes.
And so as these factories and these other businesses where contact may be a little bit more closer, and you're with another worker for longer periods of time, that there may be an increase in numbers also.
It may be. That's why at least following the minimum requirements that are on the Healthy at Work website is so important. Businesses still have to come up with ways to physically distance their customers from their employees and their employees from their employees to prevent the spread. They have to wear those cloth face masks. They have to kind of stagger times that they enter into the businesses so there's not, for example, if they have a time clock where people clock in, then that should be staggered so you don't have a group of people trying to clock in at the same time. They need to be taking temperatures as well to make sure that nobody's coming in symptomatic. All of these things need to be, and for those individuals who are at high risk, so 60 and older or 65 and older, they need to find ways for them to continue to work at home if at possible. So all of these things can help keep the customers, the staff safer. And so we're hoping that they will do all of these things to help reduce that possibility of spread.
Well, I know with the school district, we've got a lot of unanswered questions. And locally, the school boards are looking at many possibilities, the what ifs and things. And so I think you all do help with those decisions too, correct?
Those plans that I mentioned earlier, Brian helps to review those. There's a lot of guidance that came down from the Kentucky Department of Education. He has looked at that, and so when schools implement or send him that information, he is basing that guidance off of what that is, and of course all of the public health. He's trying to mesh the two so that he gives the best possible advice as schools reopen or consider.
Right, and many things are still undecided at the present time.
Yes.
The other thing is that large group. Right now, the governor still suggests 10
or less.
Or less. What about in open spaces in regards to that? With Freeman Lake being open and the nature parks and things along that line. I recently videotaped the Memorial Day ceremony at the Elizabethtown Nature Park, which is also, I would call it the Veterans Park as well, but it has the wonderful replica of the Vietnam War Memorial. And even though there wasn't a public ceremony, there were still a number of people in that area for that. Actually, they were just coming to look at the park. So it was nice to have a gathering there, but it wasn't. People were not close. I mean, I think everyone still there were masked. Were wearing masks. They were keeping probably a 4 to 5 foot. I don't know. I wouldn't get my yardstick out and measure, but it seemed like people were complying, especially with people they don't see on a regular basis and things. So our sporting events and our events that have larger group numbers, those right now do not look like they're going to come back anytime soon.
I don't think so.
I'm sorry, in terms of having audience or ticket purchasers and such.
Right. Unless the governor changes it over the next couple of days. You're right. We're still at 10 people or less at a gathering. And then June 29th, it goes up to 50 people or less at the gathering. So he also is expanding youth sports activities, and I have no idea on June 29th. I have no idea what that will look like, but we may have more information on by the end of June.
Right. I know that with the Kentucky High School Athletic Association, they had put out a large document and guidelines for school districts to abide by. I'm assuming that the NCAA has also done the same thing. With that in mind, it's still a good thing to get out and exercise and get in the open air type of thing. That's a good thing to do anyway.
It is.
I think especially with people isolating themselves, it is a breath of fresh air to be able to go outside, to walk outside, and to because that has never been restricted really. You you can take long walks and things like that. You just don't want to do it with a large group of people.
That's right.
Right.
Limit it to your family. I'm going to keep saying that, or people in your household. Walking is good for the physical health, the sunshine. I mean, it just helps. Well, me especially, my mental health is improved when I'm able to get outside and move a little bit.
Right.
So walking and hiking in your neighborhood, or walking in your neighborhood, is good. Riding your bicycle with your family is always good. If you're going to go running, you don't need your face mask on if you're running alone or with your family. So just keep those things in mind as summer heats up.
Anything that we haven't covered that you'd like to mention for us today?
Actually, yes, I would. We have just, Lincoln Trail District Health Department has just, we're really trying to ramp up our messaging to teens and young adults. So we're looking at the ages of 13 to 25-year-olds. And so we have put a web page on our website that we want them to go to, not just for COVID-19, but for just general information about any topic. But we need their input on what that content should look like. What do they want to see on a web page that's designed for them? Mm-hmm. So if they could go to our Facebook page, the SurveyMonkey link to the survey is at the very top. It's pinned to the top. We would love to have their input so that it will guide our decision on what the page should look like.
So again, you want to encourage all 13 to 25-year-olds to go to the Lincoln Trail District Health Department's Facebook page.
Yep.
And click on that
SurveyMonkey link.
SurveyMonkey
is pinned to the top. Mm-hmm. And on Facebook, we are known as Lincoln Trail DHD.
Okay. Mm-hmm. Okay. Awesome. Well, again, thank you, Terry, for all of your all's committed work, everyone in your department. I know that you all have been, hopefully the time frame, you're not having to do as many overtime hours, but you have to stay vigilant. So
yes, we do.
Okay, we appreciate that, and thank you for joining us today. And thank you for joining us at home. And again, if you have any questions about COVID-19, the Lincoln Trail District Health Department's website is phenomenal with information, and also you can go to the governor's site as well. Always great information is on there, and it's really current, super current. So thank you for watching today.